Hi, everybody. My name is Brooke,
And I'm Brianne.
and we're going to talk about our case study presentation. Our case study is about a client named Shay. She is 14 years old. She is a female. She has her pronouns, and she is in the ninth grade. Some background about our client. She was placed in foster care at age 2 with her now adoptive parents named Renee and Ronald. She was adopted at age 6. Her biological mother died by suicide after Shay was placed in the foster care system. Her biological father was not present until about 2 years ago, and she has one biological sister where nobody is sure where the sister is. And there's limited information about Shay's experiences or family dynamics prior to the foster care placement. The presenting problems for Shay in this case study is that she's struggling to focus in the school setting, struggling to complete schoolwork. She engages in self-injurious behaviors, which include headbanging, scratching existing scars, and cutting, and she has difficulty utilizing healthy coping skills. Shay describes feelings of intense sadness with themes of feeling lost and hopeless. In these moments, she identifies wanting to escape and not exist with these feelings and says that engaging in self-injurious behavior provides relief. Shay does well in school and enjoys learning despite struggling with attention and following through. She identifies the self-injurious behavior as an escape from the current feelings and doesn't do it to die or with the intention to die. And self-injurious behavior is increasing in frequency weekly, and she identifies the self-injurious behavior as a coping mechanism. We've identified some positives of Shay's case. She enjoys spending time with family at home, especially during dinner time at the family table. She reports having a positive and healthy relationship with her parents, and she enjoys photography, art, and poetry. She likes when her parents ask about her day, and she says that this shows that they care about her. And she states that they show a lot of encouragement and joy, which makes her feel good and validated about her skills. From the provider's perspective, Shay is resilient and future-oriented. She engages in treatment. She identifies and practices coping skills during sessions. She has supportive parents, and she has insight to her mental health and stressors. Insight to the sessions. Shay attends sessions twice a week. She identifies her home life as being calm, peaceful, and has pretty decorations, but is quiet. And this is a quote from Shay, quiet makes me think deep into my identity, and I just don't know who I am yet. This case study focuses on an adolescent girl who is struggling with self-identity. She is adopted, and despite having the supportive parents, she struggles with maintaining safety in the home. She has been hospitalized 3 times, and her parents are very concerned about maintaining safety in the home as her behaviors continue to escalate. Next, we'll move on to the diagnostic assessment. The primary diagnosis that the clinicians here established is major depressive disorder and the secondary diagnosis of generalized anxiety disorder. The diagnostic criteria for major depressive disorder, she meets 5 criteria of criterion A, which are depressed mood for most of the day, diminished interest or pleasure in all or almost all activities, fatigue or loss of energy nearly every day, feelings of worthlessness or excessive or inappropriate guilt, and the diminished ability to think or concentrate. She meets the recurrent subtype because she's had episodes not meeting the criteria for major depressive disorder for at least 2 consecutive months, and then the symptoms presented again. And then for criteria B, C, D, and E, these symptoms cause clinically significant distress or impairment to the social area of functioning, as well as it's not better explained by schizoaffective disorder or other diagnoses that have psychotic features. The diagnostic criteria that are met for generalized anxiety disorder, A, B, C, D, E, and F. That's excessive anxiety and worry occurring for more days than not for at least 6 months. She finds it difficult to control the worry. The anxiety or worry are associated with three of the following symptoms: restlessness, being easily fatigued, difficulty concentrating, irritability, muscle tensions, and sleep disturbances. The anxiety, worry, or physical symptoms can cause clinically significant distress or impairment in the social or other areas of functioning. And the disturbance is not attributable to psychological effects of a substance, and it's not better explained by another mental or medical disorder.
So these two clinicians applied person-centered theory and a cognitive behavioral approach. The person-centered approach allows for the therapist to foster a trusting and supportive relationship, utilizing congruence and acceptance. Shay can really focus on identifying personal goals for herself in this safe and collaborative environment with the therapist. And the goal here is to facilitate and encourage um, the use of the client's strengths, confidence, and being aware of themselves and what she internally needs. The cognitive behavioral approach is going to help Shay recognize her triggers and the feelings that accompany her response. Through identification, we can work through how to utilize coping skills when the sensations occur, and this includes alternate behaviors that are positive um, Shay can engage in to replace maladaptive behaviors like her self-injurious behaviors. And the combination of these two approaches are useful in the complexity of this case, given Shay's desire to do well and develop the positive relationships with her parents and other adults. These techniques can highlight strengths for Shay while fostering a safe, positive relationship to assess her needs. So the next steps that these two clinicians have identified is it includes continuing therapy sessions. Shay shows great potential, but she fails to implement skills outside of session and resorts to maladaptive behaviors. It's important to increase the self-motivation in this area. It's necessary to monitor her self-injurious behaviors and progress throughout the intervention. Bringing in Shay's family, her adoptive mom and dad, would only be done so with her consent, and her parents want to understand how to better support her, especially in crisis, to avoid further hospitalizations, and Shay wants a good relationship with them and really values that. It could help Shay recognize her familial support as well, providing just a little extra boost of confidence and connecting Shay and her family to resources in the local community and other organizations could be beneficial. It could be resources to aid in mental health or crisis, education on development of teens, or something to foster social connections. And so applying a framework to uh, this case study helps to understand just how complex it is. With cognitive behavioral therapy, um, this framework helps to recognize what is triggering Shay, the initial lead up to her maladaptive behaviors. And here we can stop and identify what thoughts, feelings, and events precede these behaviors. How can skills be utilized in heightened emotions and identifying other um, release type behaviors that Shay can engage in. And in the in person centered, perspective, we're identifying Shay's strengths, values, and goals to help her increase her confidence and awareness, ultimately helping Shay to overcome the resistance she's feeling in actually utilizing the positive coping skills she's taught in sessions, and eventually to meet other goals that she identifies. And so some takeaways from Shay's case, it was a really good case study with a decent amount of info on her social and family history and functioning, and she exhibited a complex and ranging severity of symptoms. This case showed the need to utilize all of the information obtained during the social history and over sorry, to help you best understand how you can overcome the missing information, like in Shay's case, how she doesn't have the information from before she was adopted or placed in foster care. And it really highlights the strong need for social and family history to aid in assessing the client. And there's also a value seen in involving the client supports in the therapeutic process.
And our last slide here is just for references.